Hello, everyone, and welcome to the Facebook Live this week. My name is Ashley Baldwin from the Department of Communications at the Pan American Health Organization, and I'm joined here by three experts from the World Health Organization and the Pan American Health Organization on mental health. And today we're going to be talking about mental health in the context of the COVID-19 pandemic. So I'm joined here by Dr. Deborah Kehtel, who's the Director of Mental Health and Substance Abuse at the World Health Organization. Good morning, Deborah.
Hello, good morning.
I'm also joined by Dr. Maristela Monteiro, Senior Advisor on Alcohol at the Pan American Health Organization. Good morning, Maristela.
Good morning. Hi.
And finally, Dr. Carmen Martinez, Sub-Regional Advisor on Mental Health at the Pan American Health Organization. Good morning.
Good morning, everyone.
So welcome, everyone. I'm delighted to have you all here. We're going to talk a little bit about mental health in the context of the COVID-19 pandemic. I have some questions for you, but one of the most important aspects of this Facebook Live is to listen to what some of the questions that our audience might have. So I'm going to ask if you have any questions at any stage of this Facebook Live, please don't hesitate to put them in the comments below, and we'll get to them as soon as we possibly can. Those should be questions about mental health specifically. We'll be having other Facebook Lives over the next few weeks, every Friday, to answer other questions about other aspects of the pandemic. So in the Americas, we are currently experiencing a COVID-19 pandemic like everywhere else in the world, and there have been 1.29 million reported cases and over 69,000 deaths due to COVID-19. The majority of those are in the United States, but these numbers are continuing to grow in other countries in Latin America and the Caribbean too. So we're still very much at the early to middle stages of this pandemic. And when we look at something as devastating as this kind of global pandemic, it's really important to look at mental health too. We know that mental health issues represent 22% of disease burden in Latin America and the Caribbean, which is pretty phenomenal. That means that 22% of all conditions that we have in this region are due to mental disorders. And when it comes to emergency situations, particularly pandemics, other kinds of emergencies, we know that 1 in 5 people can experience a severe mental health disorder as a direct result of that particular emergency situation, and certainly a pandemic or other kind of outbreak is no exception. So I'm going to start off with a quick question for Deborah, and that's, how is this pandemic affecting our mental health generally?
Thank you, Ashley. Thank you for the question. I think that we have been talking and listening already for a while about this, and I believe that people is aware that it is affecting our mental health because of a number of reasons. In any crisis, it's natural, it's normal to feel stressed and worried. And this is the situation we are living right now and has been going on for a while. So we feel fear and anxiety of not knowing whether we will become ill and could die, whether loved ones are in the same situation. We have been going, in many cases, through weeks and weeks of staying at home, in a totally not usual situation, with all that may imply. Some of us are exposed to a huge level of stress because of working directly with people with COVID. I'm talking particularly about first responders, right, in the health sector and not. We have the problem related to elders, and whether we are worried about somebody that may be in a home or somewhere far away, or we are the elders that are the older adults that are concerned. So a number of groups, the uncertainty about the future, the not being able to go to school and talk to our friends, not knowing if we will be able to graduate as expected, not knowing if we will have a job tomorrow or a salary, or how are we going to provide to our loved ones. So all of this is naturally creating some fear and some stress. And I would say that fear, stress, anxiety, these are the most common issues that are normal to feel right now, but that doesn't mean that they are less serious or less hard on us to cope with. And those issues could go away as soon as the situation goes back to normal, or may stay a bit longer and become more serious, severe mental health issues. I think that an introduction to the topic, I could stop here and listen more about what else do you want to know.
Thank you, Deborah. So I guess this brings me to the $1,000,000 question then, Carmen, and I would love to know the answer personally as well as for our audience. So what can we do about it? What advice do you have for managing stress?
Okay, thank you very much. I think that continuing a bit with Deborah's comments and about the situation, I think it's important, first of all, to think that most of the time, what we need is to really take care of ourselves as we should do in regular moments. But it's true that in this moment, we need to take care a lot about our emotional health. We need to be very conscious about it. And being very conscious means that we need to be doing very simple things. And one of them is not just related to mental health, it's just having a healthy lifestyle. What do we mean with that? Of course, having a healthy diet, so eating proper foods with healthy elements, but also taking good rest, and at the same time doing exercise. We know that it's difficult sometimes to think, how do we do exercise when we are at home? But at the same time, we can be quite creative, and there are many resources that help us to know that we can do many exercises, even if we are in a very small place. So it's important that we try to keep regular, hopefully everyday exercises. And at the same time, combine it with having proper rest. So we need to try to have regular sleeping. So we need to not to get disorganized. I think that's also one of the points. It's important to take somehow some routines in our daily lives, because even if the situation, especially staying at homes, it's not easy for that. It's important that we really try to be a bit organized in that sense. Another very important recommendation would be, let's talk. So let's communicate among ourselves. We need to be communicative, even if sometimes we don't feel like that. We are not that used always to have with many people that we regularly have daily contact or regular contact. And now it's important that even if we are not in the same place and we cannot have this physical contact, that we continue talking to them. We have telephone, we have email, we have virtual means. Nowadays, most of the people have the possibility. So let's really use it, even if sometimes we don't feel like doing it. That's very important. At the same time, we are surrounded about so many information, but many information, it's not really the best. So it's important to be seeking reliable information and keeping really updates on what's going on. It's important to be doing it regularly. So we need to have this information about how the pandemic is going, how it's affecting our community, but at the same time trying to be very conscious, very cautious also about what's the reliable information. So of course WHO information websites, PAHO website, but also the ministries of health and in general the authorities at your country are important sources of information that it's important to be keeping, but also not all the time. So let's also try to be leaving some time during the day, a couple of times a day, for example, to get this information, and not just being, for example, in front of the TV all day long, just listening and listening, which is going for sure to be also emotionally disturbing. And maybe after we will continue for sure giving some suggestions and advices, but maybe to emphasize that it's important to think about what has been useful in other moments of the life where we were also struggling with our difficulties, and trying to see what was useful in that moment. Sometimes we forget about those useful resources, and now it's time to think, to recall them and use them again. I think for time, I think it's I think the main recommendations.
Brilliant. So we have recommendations that people should be trying to get enough sleep, should be exercising, should be making sure to stay in touch with family, friends, colleagues via virtual means where the physical means don't exist. But sometimes when you're feeling quite stressed, and we here at PAHO have been at home for, I've lost all sense of time now, I guess 6 weeks, maybe it's 2 months, who knows. It can be quite tempting to try to relax at the end of the day with the help of, things that perhaps aren't that particularly good for us, such as alcohol or other substances. Maristela, when we get this temptation, what effect can resorting to these, alternative means really have on our mental health?
Thank you for the question. We have seen many changes in the way people drink and the way alcohol can be bought. And of course, first of all, it's important to remember that alcohol is a risk to health, physical health, mental health. There are over 200 diseases associated with alcohol consumption. And alcohol is a sedative, is a depressant. And even though people imagine that they can relax, or it just actually increases the level of stress, of anxiety, can worsen panic attacks, depression, and so it's not a good combination. Alcohol at night can interfere with the sleep, so people may think that, well, I'm going to drink so I can sleep because of all this stress, but the pattern of sleep is altered and you don't feel relaxed. The next day you may get even more irritable. And there were shortages and reductions in alcohol sales because bars, restaurants, casinos, and nightclubs and festivals, all the public drinking had reduced dramatically. But what has happened, and then the consequences of that are expected to decrease: the violence on the streets, or public disturbance, traffic has decreased, and it's possible that alcohol-related drink driving also has decreased. We don't know to what extent actually, but what was public became private. The alcohol consumption came to the homes. And the issue is not only coping or not coping, but it became also to flourish all types of events at home, virtual events, happy hours, and the normalization of drinking during the day. Those who are working from home then are drinking, or maybe become, regular drinkers. At lunch, they stop and they have a drink, and they continue in the afternoon, and after in the mid-afternoon have another drink, or after work, telework, they drink. But this also is associated with the development of tolerance for alcohol. And when we are in the workplace, we don't drink and work, and people need to be mindful that their capacity to concentrate will decrease, and they can get even more bored, less able to perform if they drink during the day. Another point that I think is very important is being at home. In all this stress, there was circumstances that are described with kids, sometimes elderly, or a violent partner at home. The drinking will become worse. With kids watching their parents every day coping with their situation by drinking, they're learning that same coping mechanism. And we are going to see increases in alcohol consumption among adolescents as time passes. They can also have more access to alcohol that before was more difficult because the drinking was happening outside. And finally, there was some mention about misinformation, and this also has had a very disturbing impact, negative impact in several countries, because alcohol has fake news saying that alcohol can protect against coronavirus, and it doesn't protect. Initially, that people with alcohol dependence would not get, so they could continue to drink. Because of their drinking, they wouldn't get the virus, get infected. But alcohol is an immunosuppressant, and it can facilitate the infection. It can worsen the infection, especially pulmonary respiratory consequences. And because of this fake news, finally, also people began to access alcohol illicitly, or homemade and mix with products that are not for drinking, like methanol. And that has led to dozens or hundreds of deaths. In the case of Iran, for example, is over 800 deaths already from methanol poisoning. In our region, Dominican Republic is another case that 30 deaths already have been reported. And these are the dire consequences, but also it causes blindness, kidney disease, and other consequences that are non-fatal, but are incredibly difficult for everyone.
So I guess what's, commonly marketed as something that's going to help us relax and chill out and cope with stress, it's actually incredibly counterproductive, and we're just making things worse for ourselves by resorting to alcohol and those substances. I'm just going to take this opportunity to say, if anyone has any questions, please pop them in the comments section underneath and we'll address them. We've started to have a couple that have come in, so I'll go to those before I go back to my questions. I have many more for you. So one question, which is from Melissa Caesar, says, can you explain why the unchangeableness of the current routine can have such a negative impact on emotions? So I guess it's what Carmen was saying, we go to bed, we get up, we're in the same house, we work if we're working from home, we exercise in the same house, we watch television in the same house, we communicate with our friends and family in the same house. There's still a considerable monotony to our routines, as interesting as we try to make them. What kind of impact can that have on mental health?
Thank you. It is interesting because we keep doing a number of issues, but some part doesn't change, right? That's a bit the issue. We keep talking, we may be working, we may be, we eat, we contact friends or whatever else we do, but there is a part of it that is not changing. And I think that's the boredom that comes with that unchangeable context is the issue that comes to the attention that might generate some anxiety on one hand, because it's not we are unable to do what we used to do, or we are unable to enjoy things the way we used to enjoy previously, doing the same things. Or it could also be the other way around and generate some kind of depression, of again, feeling unable to perform as we used to. The ways to cope with both options are a bit what Carmen mentioned earlier. How do we pretend that we do have a routine in this, a different routine in this routine we are all right now. Of course, there are conditions and conditions being at home, right? It's not the same being in a house with 4 or 5 rooms as being in 4 or 5 in a house of 2 rooms, right? So depending on that, there are things that are very honestly very hard to overcome, and we need to make peace with that and saying, okay, this is the situation right now, and I need to see how am I being how am I able to manage this situation. When I was listening to the suggestions that we give, I was recalling some jokes that we also see in the media, that okay, now I need to exercise, I need to be happy, I need to do yoga, and I need to do a number of things. And yes, it is more demanding and it is hard. But this is what we need to do in order to be able to compensate for all what we are not having access to right now. So how do we maintain the balance? By doing more of these issues that normally we wouldn't pay attention to, maybe.
So it's not easy, and it's never going to be easy,
No,
but by doing these things
easy
that you've suggested and Carmen has suggested, it's going to help us in the long term.
I think that your point is key. It's not easy. It's not an easy situation, and nobody is happy because we are put in this situation. But we are doing this because we have a public health concern, and the risks are at stake are really high. So we are doing this in order to protect ourselves and our loved ones, and that's something that we shouldn't forget as well, right?
Yeah.
That whatever is the challenge now is in order to be better, or to avoid getting worse. So that's, again, the exercise that we need to go through on a regular basis, I guess.
Yeah. We've had another question from Tricia Shekels as well, and I think it sort of, it broaches 2 issues that I want to talk about. And the first is, what about all of those people who have lost their jobs as a result of the COVID-19 pandemic? Tricia has given the example of, she's also a single parent, so she's lost her job. She has worries about, reduction in income, which lots of people have at the moment. We've seen the figures from here in the US where we're based, and they're phenomenal, and it's the same or similar in many other countries. So, what can we do about issues such as unemployment and economic worries? And then I guess, what are the links to other issues? I don't know, Maristela, if you want to weigh in on this part, when it comes to things like increased alcohol consumption, domestic violence, those kinds of things. We're under so much more stress than the stress of being at home. We also are worried about our jobs and our children. And
yeah, I could start, and then other colleagues can follow. But I think that, yes, not everybody will cope in the negative way of going through alcohol or other substances or violence because of the high stress. There are other ways of dealing with that, but this is a big risk nevertheless, and we know. Now, it is true that the risk of unemployment now and in the future will have an impact in mental health. There have been evidence in the past of, for different reasons, but serious social crises that have produced a documented impact on mental health, increase on also suicide in populations, specific groups, etc. So this is an issue that has to be dealt with on individual basis, again, with the same advice that we gave before on how to cope with this issue. How do we not allow a very serious factor impact us more than needed. That is on the individual basis. But I think that we should never forget that there is a family around us, and there is a community, and there is a society, and there are governments. I do not think that all the responsibility has to lay in the individual person. It has to be shared. It's the individual capacity to overcome this, but also what other measures are out there. And I'm sure that there are already many working on that at that level, trying to generate measures that will help getting out of this. That will be my introduction, but I want to stop here to leave it to my colleagues there.
I would like also to add that I think that it has been somehow said, but I think we need to highlight that the fact of feeling this stress, this feeling lonely, feeling that you are really very very overwhelmed by the situation. This is something that it's absolutely normal, considering the situation. So first of all, I think we need to take it as something natural, reacting to this. And of course, then how do we try to manage our reactions? That's the key point. And that's where, for example, trying to avoid all those substances such as alcohol, all those actions that could be related to violence, or in general to non-communicating properly and not having like healthy relations, etc. That's something that we need to take care and try to manage and to control sometimes, no? But I think that it's important to be somehow feeling natural that these are common reactions in these situations. And again, as Deborah said, there are of course to all these risks, there are many ways how we can cope. And I think that's, again, an important issue of not getting this just individually, as being supported, as Deborah mentioned, by family, by our loved ones, and about the community. And we are really trying to raise our voice to say, well, it is also a governmental, of course, responsibility, and it is important to be taking some actions, some decisions in that sense.
Right. Yeah, and if I can add a little bit,
please.
Is to be kind to oneself. We are all going through more or less problems, and the problems are likely to pile up as the time passes and we don't resolve the situation, and so the lockdown continues. And the one thing that we can change is the management of the stress, and finding healthy ways to do that despite all the problems. And of course, I can't even imagine on a family going hungry, but the stress over that will reflect on the children, will reflect on the relationships, and it just it may worsen the situation. So these basic measures in terms of a diet, mindfulness, sleeping well, adopting a routine, trying to be physically active. It can be dancing, it can be jumping in a different place every day, whatever creativity, and looking for help when it's needed. There are now hotlines and places to vent your frustration. I think that's how we continue strong or get stronger. And instead of relying on alcohol, for example, or drugs to forget for a moment or a few moments of all those problems, they are not going away. They will stay there, and after with a hangover too.
Right.
Actually, sorry, may I?
Of course.
We just launched yesterday a new book that I would recommend, because it's very much related to this. It is about how to deal with stress, precisely. And one of the issues that Maristela just said it, ask for help. And there are a lot of opportunities out there that are related to access through internet. There's plenty of things out there, but otherwise, talk to a colleague, talk to a friend, talk to a relative, talk to your neighbor, talk to somebody. That's the issue, because what now may seem dramatic for us, and it is dramatic, it may be seen differently by somebody, and that can help us. And then there is this recently, yesterday launched materials we still have from the...
We can put the link in the comments once this is over.
Okay, great, fantastic. And it's called Doing What Matters in Times of Stress. And it's an illustrated guide with a lot of designs, with a very concrete tips, suggestions of what to do on daily basis, and practice and practice and practice until we manage to change some behaviors. And we will learn how to deal with stress in tough times, like the ones some of us may be living tougher than others, but a definitely difficult time for everybody. So we will put the link there, maybe, and people can access it.
Yeah, you can access that resource. Just following on from that a little bit, excuse me. We've had a question from Fernando Freitas, and he says, anxiety, rage, fear, when do those stop being stress and start being a problem?
Thank you for such not an easy question. I was recalling, listening to the question, I was recalling a publication a couple of years ago that was talking about a gradual movement from the being okay, the feeling okay, and becoming an illness that is around mental health, from being mentally healthy to have a mental disorder. What is in between, and how do we move from one to the other? There are a number of clinical issues that could identify that change. Maybe it is enough for us to focus now on how to deal with the stress and how to try to overcome and move away from that level of anxiety, instead of going in this context into the diagnostic characteristics that may be clinically defined, and there is a manual saying what is anxiety when it becomes a disease. I think that the time has to be with that, and the intensity and a number of other signs are relevant to that. But I think that we can say there is a continuum from being okay and feeling something to becoming a serious issue that we need to monitor and see how we manage.
And we've had more questions. I mean, this is a follow-up from Trisha's question, really, and she's talking about being a single parent. But at the moment, we need to remember that as adults, this is very difficult to manage, this situation. Those of us that are in lockdown, it's incredibly frustrating, and we're dealing with anxiety and fears and all of these very normal emotions. But when it comes to enabling our children to best prepare for those things, what can we do? How should we talk to children about this pandemic? How should we address their fears?
I think that the first point is related to the end of your question, how to talk to them. I think that the first point is that sometimes we believe that these issues are so difficult, so complicated, about talking about the pandemic or talking about the COVID as such. And we tend to think that this is not something to be talking to children. And this is the other way around what it should be done. We need to talk to them. But of course, we will not talk in the same way that we are talking with another adult. So the first thing is to try to manage and adapt our messages and the way how we are communicating with them with the children, and of course adapting to the different ages of the children. So that's important. I mean, with some of them, maybe it's not just talking, it's communicating in other ways. So we can be, for instance, we can be doing drawings, we can be playing with them, we can try to do some kind of role playings to try to understand what's going on. And there are also some resources. We have, for example, the storybook that was launched also internationally, which is My Hero Is You, that we can also, I think, add afterwards the link.
We'll put the link in, we'll put the link in, Carmen.
Thank you, Ashley. To try to give the resources that, you know, that carers and parents can use with them. But it's very important to really be talking to them, and not only talking about the COVID or the situation in general, but also be talking more with them about how they're feeling. So it's an special moment to take care of them. It's very common that children are also feeling, you know, a stress and feeling, you know, other feelings that were not common before, the same as we do in adults. It's just that the way how they are showing, it's a little bit different. And they can be more clinging, for example, to us. They can be like, if we can feel that their development has like gone back again, and they are doing things more like a baby or like a younger child. And that's all of them are normal reactions as well. So being more close to them, even if, of course, being with them all 24 hours is something that can be also very exhausting, of course. But it is a moment, as we were saying, to take care of ourselves, but also to take care especially of our children. And in that sense, as I was saying, just playing and drawing and talking about that, but also playing in general, facilitate games, facilitate different ways of being a bit more distracted as well. It's important. Those that are continuing their school classes at home, well, they have an overcharge, and it's also for adults also to be helping them. But it's also important to be keeping routines again. Routines for children are a key issue in these moments where, especially being at home, and as we were mentioning for adults, it would come again for children. It's difficult, but it's important that they have a feeling, and you know, that life is going on with quite a structured way. I would just the last thing I would like to say is let's be very clear with them. So let's be attached to them. They need especially this now, and they need that we are not hiding things to them, even if we are adapting to their ages.
And I guess that brings me on to, what about parents? Because, you know, we hear a lot in the media now about parents, they're at home, they might be working from home, they now have childcare duties whilst they're working from home. There's a pressure on parents to keep children in education and make sure that they're studying and doing their homework and attending virtual classes if those are available in a particular country and area. There's no help from family, there's no help from friends. Do we have any recommendations for helping parents cope with this, you know, sudden onslaught of additional responsibilities that perhaps were shared prior to some of these social distancing measures for the pandemic?
But I think that's a very good point, because all the discussion we had earlier about the challenging situation and the stress related to this is not just the virus, but it's also this that you just described, right? Is I have to do my job, and on top of that, I have to do the job of the teacher that was taking care of, and on top of that, I have to do whatever else, taking care of the house, and I mean, all of that, whatever other tasks and responsibilities were shared, now are all concentrated. I think that other than what we just said, it is important that getting help, whatever it is important. maybe putting a child on the phone with a grandparent for a while every day could help. Have some time off, and then having a grandfather or grandmother entertained as well, and having a important role to accomplish, and having the child connected. That could also be something done in the neighborhood. But also maybe there is a discussion, important discussion that needs to take place with managers, with supervisors, and saying, I'm sorry, but I can't do my whatever number of hours a week because now I need also to take care of my child. And I imagine that many managers will understand because they are going through the same situation.
Right.
And so this is something when we talk about what's happening, it is also related to that. Talk to your peers, your family, your friends, but also to your bosses, supervisors, whenever possible, to come across with that and see how together gradually some kind of normality becomes manageable in a way.
If I can say something, as I have two more adolescents at home, and we all need, as parents and the children and adolescents, to have their own time as well, alone, sometime with the partner, without children. So all this needs to be organized together, and so it fits in. And but with older children, you can also teach them new chores that will serve for their lives, on cleaning or cooking. And
let me know how that goes, Maristela. Let me know how that goes.
Exactly, yeah. And so everybody's a little active and doing stuff. It can be games as well, but also the responsibilities for future life. I've been cooking a lot with my children, teaching new skills to them, and that's good when it's a fun time, and it's during a time where you can talk about other stuff, how is going to be the future, anxiety. They all miss sports and seeing friends, and you can discuss that with them.
We've had a comment from Laura Liu, which I think is important to reiterate, which is there's a difference between working from home and being at home working. And we are at home working, and that's not by choice for many of us. So language is important, and that's true. And definitely, like Deborah mentioned, it's important for employers to take that into consideration, for managers to take that into consideration. These aren't normal circumstances. This isn't my, bi-monthly work at home day. This is a very different mandated way of working in order to deal with a pandemic. So that definitely needs to be taken into consideration. We've had another couple of questions come in, and they mostly deal with how frontline staff, how healthcare workers, how other essential workers who are on the front line of dealing with this crisis, what recommendations do we have for them as far as dealing with issues of fear and anxiety and mental health issues are concerned?
I think that
Go ahead.
Okay, you can continue, Deborah, later. I think that it's first of all, it's important to again be clear that feeling this stress and other feelings as something very common. When we are in the front line, we are dealing directly with with the pandemic as such. We are dealing with the sickness. We are dealing with death. And also with all the environment around this, with all this fear, it's absolutely normal to be feeling sometimes frustrated, to be feeling helplessness, but all this can arrive to be overwhelming, of course. The point is how to try to, again, use all these recommendations that could be for everyone, but especially important for these people that are these heroes that are in the front line, and that they have double, triple, stressors at the same time. So it's important to first recognize that they need to take care of themselves in their physical and their mental health. Both of them are important, and in that sense, even if they feel, and sometimes even their workload and the time that they have been working, it's really long hours, etc. It's important, and this comes also to managers, that the resting, having again some routines, doing some exercise, and doing some things that are really pleasant for them, in daily basis. It's important. Sometimes they even have the difficulty that they cannot have the normal communication with their loved ones, and they cannot be with them, or they are isolated, or even because of the stigma that it's occurring at this moment, especially with health workers and with other frontline workers that are still more in contact with general population. This brings sometimes to be feeling very, very, very lonely, and that is something that it's another stress that it's very difficult. Talking to their loved ones, even if it's again by phone, virtually, that's something very, very important in these moments. But also talking to their colleagues. The situation that everyone has, of course, will have some particularities, but in general, they have very, very similar situations. And talking to them, even having some informal groups for talking, with different means, and sharing their experiences, their feelings, can be really something very, very helpful. And again, recalling the strategies that used to be, useful in other moments of difficulties of their lives. I think that's something very, very important. But I would really emphasize the part of communication. Please, Deborah.
Not much more to add. I think that just to stress the role of managers, that the managers are responsible also for making sure that all these recommendations are taking some time in the routine, that the shifts are having some break in between, are allowing people to have a break in between, that the possibility of buddies, they're putting peers together to talk, as Carmen was suggesting, that in any break, if the manager will have the time to read something about how to provide a good advice or how to be a good listener to some of these issues, will help. Some kind of basic psychological first aid knowledge could help, that the manager has to help somebody that is going through very tough times. Is not just being tired and stressed, but is also facing tough decisions. There is an ethical dilemma frequently nowadays faced. There is facing the horror of what is happening in particularly those working in some settings that are more exposed to that. So the fear is more intense than the one I can feel by being here at home. I mean, it's completely different. So the mechanisms in place should be there. And again, it's not just all on the individual. It's the individual and it's the context. It's the manager, it's the system, is the health system in this case, is the government that has to keep this in mind. Because if a health worker providing direct care is too stressed, may make mistakes, and the mistakes are serious. So you don't want to get there. You want to avoid that a health worker is exposed more than needed to such a stressful situation. It is exposed. What can we do to minimize, to counterbalance, to take care of some of the issues that could be taken care of? Others, unfortunately, no. We need that kind of response. Okay, what can we do to help, to facilitate, to make it less terrible, I would say.
That's an interesting point that you raised there, Ora. So, we're responsible for our mental health to a certain degree, and of course we're responsible for our physical health to a certain degree. But it's also important to keep in consideration, particularly during this pandemic and during other emergency situations, that we need to look at mental health a bit more integrally, and it's something that governments, employers, everyone really around us in what constitutes the system of society, it's something that needs to be front of mind really and taken on board. So I think that that's important to emphasize, not just for frontline health workers, but for everyone else. Mental health needs to be a consideration, just like every other aspect of physical health. I just have one final question from the audience, and then I'll give my final question to you all three. So we've had a question from Sonia May about people who already have mental health disorders and who are in recovery. Do we have any advice and recommendations for them at the moment during this pandemic, when they might not be able to access the resources that they might normally be able to access outside of the context of the pandemic? They might be having to carry on working. Many of them are frontline workers. Do we have any recommendations specifically for those people?
I begin and then my colleagues can follow. I think I was thinking a couple of issues. On one hand is that among the vulnerable groups, we are talking about people with pre-existing mental health conditions, because all of this may impact them harder than to others, but also because the continuity of care may be a challenge. Access to care may be a challenge, whether it is psychotherapy or it is medication or whatever. That is for people with pre-existing mental health conditions. People on recovery, on the other hand, may have some strength that others may not, because they know what they have gone through and they know what helped them going through and overcome some of the challenges. So my advice would be, remember that. What helped you back then? Even if now you don't have the same kind of, the access to the same kind of support, you know what helped you, or you could have somebody helping you, reminding what was that helped and how to get that kind of support again, whether it was something from you, again, from external sources. As it was said earlier by my colleagues, there's plenty of resources online, and many of them are very good. If you have been in recovery and you know what has helped you during that pathway, you can find similar support temporary on internet-based manner, if you can have access to internet. If not, again, go back and knock the virtual doors of those that help you back then will help you again. So do not forget that part of the experience that you have.
And Maristela, what about people that are in recovery from substance
abuse? This has been an issue in several dimensions, I would say, because one is the added stress can facilitate relapse, and people go back to the drinking. And there were people recommending actually that they would stockpile alcohol and not go into treatment, for example, if you are an active dependent on alcohol or other drugs. And but rapidly several self-help groups have become virtual. And like Deborah was saying, having the peer support is very important, and usually people have someone who guide them, mentor them, or work with them in this process, and they can be activated. For English-speaking countries, actually, I learned about a site that has a list of 24 hours a day, every day of the week, of virtual meetings that people can join. It's called smartrecovery.org, I think, and it's accessible for in other countries, in the US, but also in the UK, Australia, and that's why over 24 hours there are dozens and dozens of virtual sessions. And for those who decide to stop drink, which is a great idea during a pandemic like that, to decide to make the healthy choice and stop drinking. We do recommend, if there was any attempt before and there is a risk of a severe withdrawal, that is guided by a professional. It can be virtual, or it may be that the person will need to go to an emergency room if the symptoms of alcohol withdrawal, for example, get worse, or from opioids. And the outpatient, the person knows from the history that they have if that is going to happen. But many people can recover at home, and the withdrawal can be managed at home, sometimes with some medication, but many times without, but with support groups, with the family support. There are also virtual meetings for family of people with dependence that can seek advice and support. So it's not the ideal situation. These meetings they were always face to face, but in the current conditions, it seems to be working well, and people should look after that.
And I just have one final question for all three of you, just briefly. I wonder if you could, as we start to look forward to moving back into hopefully one day soon a normal way of life, what would be your overall recommendation for ensuring mental health so that when we do get over this hump, we're better for it?
Okay, I could start maybe saying that if I could say, the main recommendation would be, let's talk. Let's really keep communicating among ourselves, with our loved ones, with our family, with our friends, with the different virtual means, and we know it's not the same, and we miss sometimes, just giving a hug, or other means of communicating. But this is the best way that we can use in this moment, and keeping communicating, for sure, it's something that should be helping us to be feeling better in these moments of stress and all those difficult feelings. And at the same time, let's remember that if still we are really feeling that we are overwhelmed, there are professionals still, health professional supports online, by telephone. Many ministries of health and NGOs, etc., are providing nowadays different ways of accessing, and sometimes even our health centers, etc., are also running. So let's really connect with professionals when it's needed, and let's support our loved ones when we believe that they would be needing to be contacting them.
Okay.
Thank you.
Deborah, do you have one overarching recommendation?
Yeah, well, not much to add to what Carmen said. Is talk about what we know. I think that it is a lot is requested from us right now. We need to cope with all this situation that we may be facing, and in the meantime, we need to cope it well so that we get out the best we can. And this is it. There are, as Carmen said, you read everywhere examples of community presence, and I insist about the role of the community, because it is the virtual media means, yes, but some people do not have access to that, and we need to also remember that the community is out there, that the balcony events are happening all over, that the talking to neighbors is still valid, and that the same way that we were saying, let's talk about what is happening, let's do it in any way we can. That is what will help us going through, learning more about what's happening to ourselves to make a better way out, hopefully soon, whenever it is the time. And in that talking, let's not forget, as you said earlier, we're talking about mental health and substance use that should be an integral part of the public health system in every country, in every context. So let's also talk about that. How do we want this to be better in the future?
Right. Thank you.
And I would say that people should minimize their drinking. Alcohol is not a necessary part of a healthy lifestyle or a diet. And this has been shown now to be possible. And there is a lot that can be reduced. People who don't drink don't have a reason to start drinking. And those who drink should reduce their drinking, just because of all the other problems as well that it brings from drinking alcohol, including cancer. There is no safe level of alcohol for everyone at every time. So people can take that as a healthy choice for the future.
Thank you, Maristela. We've just had one quick last question come in before I let you go from Julieta Rodriguez Guzman. And it's quite interesting. So she mentions that assuming family roles within the social system that we currently have are posing to be a challenge in the context of COVID-19. And I'm assuming that she means gender roles primarily. So unfair pressure on women, etc. What advice can you give to rethink and readapt those values so that when we come out of this, we're going to be better off mentally? Is this a time to be looking at, women doing a lot of domestic chores? Is this a time to be addressing some of those discrepancies and divisions between the genders, do you think? Or should we leave that for post-pandemic world?
No, I can say beyond gender issues, I think what the pandemic has shown is the people that we used to take for granted are the essential workers that we need. And whether they are legal or not legal, they are delivering the food, the letters, the packages, transporting, and the healthcare workers that people only thought about the super specialists. Now it is all that we need and not enough. So I think that's the lesson that we're all learning, to rethink and all the housework chores that people have, and they are real and they are unpaid, and they're probably continue to be unpaid, and but that they should be valued as much as others.
And in general, adding to that very important point, she's talking about family roles, and everything is changing right now. I mean, we are living a very extraordinary situation. So I'm sure that things are going to change. How are they going to be? I don't know. I can't read the future for now. But definitely there is going to be a change. So the issue would be, how can we make the best out of that change? What can you bring? What are we learning here? What are we thinking differently? Like Maristela put the example of the workers. What is essential, what is not? That's something. And there are plenty of other areas that we could imagine, again, forcing us to think things differently and position things differently. And that will generate maybe different values, hopefully better ones for the day we will be able to go out. But I'm sure Julieta had something in mind, so maybe next time she will also let us know what was her thinking on that.
Yes, well, thank you all so much for joining us, Deborah, Carmen, and Maristela. I'm sure this conversation was very valued to the audience. We'll be back next Friday with another Facebook Live on another aspect of COVID-19. So please join us then. But thank you very much. Bye-bye.